Hello everyone, thank you for joining us tonight for our first Breathe Better class, Breathing with Confidence. I'm just going to wait a few more minutes for everyone to join us, so sit tight for now. So in tonight's class, we're going to be demonstrating some breathing techniques that can help with asthma that you can use every day to breathe with confidence. We'll also be showing you some tips on wearing a face mask, so it's just both comfy and safe. There should be a question function for you on your little GoToWebinar sidebar. So if you do have any issues with anyone, another couple of minutes. If you're just joining us, welcome to our first Breathe Better class, Breathing with Confidence. Just giving everyone a couple more minutes, couple more, let's say 30 seconds more to join, and then we'll get started with Janet. All right. So, if you're just joining us again, welcome to our first Breathe Better class. My name is Karen. I'm one of the Asthma Australia staff. Joining me tonight is our presenter, Janet Bondarenko. This is actually our first webinar in a series of 3 Breathe Better classes that we're planning on holding this year. This class will be recorded live and you will receive an email with a link to it in the next day or so. Class is going to go for about 45 minutes. I've got time at the end for questions. So if you do have any questions during the class, put them in the question box, which is in your go-to sidebar that you should be able to see. Some of them I might be able to answer in that function box during the webinar. Others will get through with Janet at the end. For those that don't know, Asthma Australia is the peak body for people with asthma. And as the name suggests, we are nationwide. We have a website with asthma information and also a phone line, so 1-800-ASTHMA, which is 1-800-278-462, where you can speak to an asthma educator for more personalised asthma information. Just as we get started, I want to acknowledge the lands we're all meeting on today. So I want to acknowledge the traditional custodians of the land we're meeting on and pay my respects to elders past, present and emerging. A special welcome to any Aboriginal or Torres Strait Islander people who are joining us tonight. I'm meeting on the Yagara land, so North Brisbane, where it's a beautiful but very wet at the moment part of Australia. Janet, where are you joining from? Janet, I think you're still on mute.
Muted, sorry. The Wurundjeri clans of the Kulin Nation.
Thank you. So Janet is going to take us through this Breathe Better class tonight. Janet is a senior respiratory physiotherapist at the Alfred Hospital in Melbourne. We're very lucky to have her. Physio specialising in respiratory are a little bit hard to come by, so we count ourselves very lucky. She has extensive clinical experience in the management of chronic respiratory disease, and she currently coordinates the pulmonary rehabilitation program and the outpatient physiotherapy respiratory clinic at the Alfred Health. On top of that, she's a PhD candidate researching the characteristics and treatment of dysfunctional breathing in asthma. So, Jenna, that's enough from me. I'm going to pass over to you.
Thank you. There we go. Thanks, Karen, and thank you to Asthma Australia for giving me the opportunity to talk about how breathing exercises can help people with asthma. So tonight I'll talk about how asthma can affect your breathing and how breathing exercises can help. I'll go through some of the evidence behind breathing exercises for people with asthma, and we'll go through some simple techniques that might help. And hopefully at the end, we'll have some time to go through some of your questions as well and help with your confidence with breathing. So asthma affects your breathing in sort of two main ways. And you can see here on the left-hand side, we've got a nice open airway where the air is coming in and it gets into these air sacs and then it can come back out again. But often what happens in asthma is that you get inflammation on the inside walls of the airway, and that causes a bit of mucus, which narrows the airways and makes it harder to breathe. And then also on the outside of the airways, the muscles go into sort of a spasm sometimes, and that constricts the airways as well. So it makes it hard to get air into the airways, but also it makes it really hard for the air to get out of these little air sacs as well. And that's what causes what's called gas trapping. So it basically means that the air is trapped in those airways and it can't get out. And that can make you very, very breathless and give you chest pains and just feel not great, basically. So it's really hard to get air in and out. And what can also happen in asthma is that it can change your breathing pattern. And I'll talk a bit more about breathing patterns in the next few slides. But it is estimated that around 30% of people with asthma have what's called dysfunctional breathing. And dysfunctional breathing is really just a term that means that your breathing pattern's not efficient, and it might be making your symptoms worse. And so that's where it's good to think about the human respiratory system as multiple components. So it's really not just about what's happening inside your lungs. There's lots of aspects to your respiratory system which can affect your breathing. So you might be breathing in through your nose or your mouth, and then the air passes through your throat, your voice box, then it gets into those larger airways and into the smaller airways of the lungs. And then there's this complex interaction between your rib cage and the muscles around your rib cage that help you to breathe in and breathe out again as well. And it's sort of this movement of breathing that we're really interested in. So if you look at these muscles that you use when you're breathing, and there's quite a lot of muscles that you can use. So on the left, we've got muscles of inspiration. So those are the muscles that you would use when you're breathing in. And one of the main muscles that you use when you're breathing in is what's called your diaphragm. So it's not a great picture here, but it's a big dome and it's a big almost umbrella that sits in your rib cage. And when you breathe in, it flattens down and it pushes out your stomach. And it should be the main muscle that you're using almost all the time when you're breathing. So it's designed to be the sort of powerhouse, workhouse of breathing. And then you've got these other upper chest muscles that sort of are designed to come in, help you out when you need it and give you some extra oomph around your rib cage, but then they should be switched off and quiet when you're resting. Then on the right, if we look at when you're breathing out, what should happen is that really you shouldn't have much muscle activity at all when you're breathing out. It should just be what's called this elastic recoil of your lungs. So your lungs are a little bit like an elastic band. And when you're breathing in, you're stretching the elastic band. And when you're breathing out, it should just be like letting go of that elastic band and it recoils and the air comes out. So when you're doing some exercise or you're talking or you really need to get your air out quickly, then you can bring in some of your abdominal muscles to really help push that air out. But really in quiet breathing, we should just be using your diaphragm and relying on that elastic recoil of the lungs. And these are sort of the mechanics of how you breathe. So what happens is you're breathing in through your nose, mouth, your diaphragm contracts, moves down, and that sucks the air into the lungs. If you're really breathing harder, then you're also going to lift and rotate your ribs. and your abdomen, your stomach's going to be pushed out. Then when you're breathing out, again, you're getting that elastic recoil, the diaphragm's moving back up into its sort of dome umbrella position, air comes out of the lungs and your stomach comes back in again. So that's what we sort of should see when we're breathing. But often a lot of us adapt these sort of strange or more just less efficient ways of breathing. And this is where breathing exercises can help. So the goal of breathing exercises is to make your breathing pattern more efficient and then to reduce your symptoms. So there's sort of the aim of any sort of breathing exercises for people with asthma is to reduce how much breathing you're doing in general and to really focus on a long breath out and then to get the pattern going so that you've got your breathing through your nose and then into your stomach. And that's the pattern we want to try and establish. So there is quite good evidence that breathing exercises can improve your quality of life and that it also reduces asthma symptoms. But I think it's also important to note that breathing exercises are really complementary to your usual asthma care. So this is on top of what your normal pharmaceutical management would be or what your doctors prescribed you to use. Breathing exercises are really complementary to those things. And we know that when you can slow your breathing down, what that does is it actually increases the carbon dioxide a little bit in your blood. And carbon dioxide in your blood acts as a bronchodilator, which means that it opens up your airways and it relaxes that muscle that was spasming around your airways. So it relaxes everything, opens up the airways. When you're doing that long breath out, you can reduce that gas trapping and enable that air that's been stuck in your lungs to actually get out. And it can really improve your confidence in your breathing. And that's going to help with anxiety and panic attacks as well, because that can be quite common when you're getting these horrible attacks as well. So this is just sort of a quick overview of some of the evidence that's been that's recently been published. So the top trial there is what's called a Cochrane review, and that is really an evaluation of all the sort of trials that have been done across the world that have been published around breathing exercises for people with asthma. So this was published in 2020, so quite recently. They looked at 22 research trials, and again, across the globe of people who studied breathing exercises in people with asthma, and they found that the breathing exercises improved quality of life, and it also reduced hyperventilation symptoms. So hyperventilation is basically breathing too quickly. And the biggest symptom from that is feeling breathless, but also you can get those sort of non-breathing symptoms where you can get dizziness, chest pain, pins and needles in your fingertips and numbing around your lips, things like that as well. And so it reduced those sort of symptoms and then also improved quality of life. So the second study there is a study that we did at the Alfred Hospital, but we were looking more in people with difficult asthma. And we found that breathing exercises did result in significant improvements in asthma control and quality of life. We saw a reduction in exacerbation, so that's when you need to take extra medication or more prednisone. And again, a reduction in those symptoms of breathing too much. And the bottom trial here is probably the largest study that's ever been done on breathing exercises in people with asthma. So they looked at over 600 adults with asthma, and these were people with sort of mild to moderate asthma who were predominantly managed by their GPs, and they gave them instructions on breathing exercises either with a booklet or just a DVD, or they had the option of seeing a physiotherapist. And both of those groups had a significant improvement in their quality of life by doing simple breathing exercises. And the improvements that they found were comparable to increasing medication. So I think that there's a growing evidence base that these breathing exercises can really, really help people with asthma and really improve your quality of life. So we'll go through some of these exercises. And really they're sort of split. We'll go through the 4 techniques today, and these are the ones that are actually being used in most of the research trials as well. And they're sort of split into 2 main aims. So the first aim of breathing exercises is to get an efficient pattern. So that is using your nose to breathe and then using your diaphragm or doing stomach breathing. And then the second part is these techniques where we're reducing your overall breathing, so slowing the breathing down and doing what's called controlled breath holds. So we will start with some nose breathing. And the reason why nose breathing is so important is that it filters the air that you're breathing, it warms it up, it humidifies it, and it helps your diaphragm work efficiently. So we know that people who use mouth breathing, who have asthma, it's associated with worse asthma control. So nose breathing is really, really important. And also people with asthma often have associated hay fever, rhinitis, issues with sinuses, things like that. So if you do have any blockages in your nose and you can't breathe through your nose for whatever reason, I would really encourage you to see your doctor, because there are some simple treatments that could help to clear up that nasal passage, because just breathing through your nose will really help your symptoms. So, all right, we can do all this together if you're there. So just relaxing your shoulders, let your shoulders drop down and relax. Hopefully you're somewhere comfortable, in a nice comfortable chair. Relax your face, relax your jaw, your neck, your shoulders, and then just pop your lips together and breathe in gently in through your nose. And at this stage, we want your tongue as well by the back of your top teeth. So if you've got your lips together gently, breathing in, and you can feel the air going up into your nostrils and then out again. So again, a very, very simple technique, but very, very effective. And be aware of how you're breathing throughout the day. So check in with yourself, and are you breathing through your nose or are you breathing through your mouth? And especially at nighttime as well. So there's a lot of us who potentially might breathe through our mouth at nighttime, where we really want to try and get that nose breathing going. And then associated with the nose breathing, we want to get your stomach and your diaphragm using. So it's really, really common, and I see this a lot, is that people with asthma tend to breathe a lot into their shoulders, into their upper chest, near their collarbones, which uses so much more energy. So like I said before, these muscles up here are designed to sort of switch on, help you breathe when you need to, and then they should be switched off and relaxed. So most of the breathing should be coming from your diaphragm. And if you can use your stomach breathing, that will help you feel, it will slow your breathing down, but it'll also reduce that breathlessness, because the diaphragm should be stronger and be able to cope with the breath. So this is another one. We're going to practice nose breathing and stomach breathing. So let your shoulders drop, relax. You can put a hand on your stomach. Some people also find to put a hand near their collarbones, and what you want to do is not feel up here. You want to feel your stomach moving. Again, relaxing the shoulders, lips together, jaw relaxed. Breathe in through your nose and feeling your stomach expand and rise. And then it relaxes down and you rest. And then again, breathing in through your nose, feeling that rise of your stomach. Relaxing down, and again, no movement up near your collarbones. And then resting. So these are really nice, simple exercises that you can try, and that will help get that pattern right. And so nose, stomach, that's really what you should be using most of the time, especially when you're resting. Slowing your breathing down is really important as well. And that is because it just really relaxes your entire body. So it's not just about your lungs, but it relaxes your whole body, but also the muscle in your lungs. So we also know that slowing your breathing down can lower your heart rate, can lower your blood pressure. So it's a really good technique to practice on its own, but it's an especially good technique if you're having an attack and you really just need to get on top of your breathing and slow it down again. I think visual cues are really great for this technique. So we talk about breathing in rectangles, because rectangles tend to be everywhere. So you might be looking at this webinar tonight on your laptop or computer, and your computer screen's a rectangle, your phone can be a rectangle, a door, a window, they sort of tend to be everywhere. So it's a nice visual cue if you need to slow your breathing down to find a rectangle. And then we'll start at the bottom left corner, and again doing your nose, stomach breathing. So we're breathing in on the short angle and then breathing out for a longer period of time on that long angle. And then again breathing in using your nose and your stomach on the short angle. And then again breathing out on the long angle. And as you go around the rectangle, you want to gradually slow the speed at which your eyes are moving around the edge to slow your breathing down. And if you don't have a rectangle with you, you can also just use some breath counting. So counting the breath in and then having a little pause and then counting the breath out. So it doesn't really matter what in-out timing you're doing, as long as that breath out is longer than the breath in. So that will slow you down and it will help get all the air out of those trapped air sacs as well. And so what I recommend with a lot of these breathing exercises, so the nose, the stomach, your slow breathing, it's really good to practice them, 10 minutes a day, twice a day if you can, just getting into a really comfortable position and working through the nose, stomach, slow breathing, and just practicing it. Because the more you practice it, the more it becomes a sort of a natural habit for you. So, try it for 10 minutes a day, and then throughout the day, just check in with your breathing. So how are you breathing? Are you breathing through your mouth? Are your shoulders up here? What's happening with your breathing throughout the day as well? And especially as we get stressed or we're working at computers, we can sort of tend to overbreathe too much and just need that reset. And the final technique we'll talk about today is what's called controlled breath holding. So this can be a little bit uncomfortable when you're first starting. So it's not sort of the technique to jump into right away, but it does help to reduce your breathlessness over time and those symptoms of hyperventilation, so breathing too quickly, and we want to slow things down. So the aim of this technique is to hold your breath after you've exhaled. So you will be doing a normal breath in and out, and then on that breath out, you're pinching your nose and holding your breath. And really starting nice and easy. So again, it can feel very, very uncomfortable the first time you do it. So it might be something that you start to try when you're just practicing your slow breathing. So when you're going around in a rectangle, you can just start with a pause at the end of that long edge, just hold your breath for a second or two, then go around the rectangle again. And then you can build up the time. So you can maybe do a few seconds, 5 seconds, etc. And then just building up to being able to do just 3 or 4 holds every day. And just throughout the day, 3 breath holds, and practicing that sense of holding your breath. So with all these breathing exercises, it's really important just to relax to start with. So we want to just get somewhere comfortable, lie down if you need to. You can pop some pillows behind your head, under your knees, and really just getting yourself relaxed and switching off every muscle that does not need to be working at the moment. So going through, start with your feet, switching off your feet, your knees, your hips, your chest, your arms, your neck, your head, and really just thinking about that nose, stomach, then progressing to your slow breathing and practicing that 10 minutes twice a day, excuse me, and then advancing to some controlled breath holds. So exercise, I'm just going to have a drink of water. Exercise is important as well, and we know that your breathing patterns do change when you're exercising. But it's important to take the medication that you've been prescribed before you exercise, but also just be aware that different levels of exercise require different breathing patterns. So you want to start with your nose, stomach breathing, and as you progress your exercise, you might need to open up your mouth because the demand of your body is that you need a bit more air. That's fine, you bring that in, you can bring in your upper chest muscles, etc. But when you finish exercising and you recover, we want to make sure that you revert back to your nose, stomach, slow breathing pattern. And if you're, scared about doing exercise because you've had bad experiences with it previously, or you're really not sure where to start and what to do, you could consider joining your local pulmonary rehabilitation program as well. And so that is a supervised 8-week program where you exercise capacity would be assessed and you'd be given an individualized program and given that support to progress your exercise. And the last thing that we'll talk about is just mask wearing, because it can be really, really uncomfortable. And we know that wearing a mask doesn't affect your oxygen levels or your carbon dioxide levels, but they can be really, really uncomfortable. So like anything on your face can feel very, very claustrophobic. But certainly practicing breathing exercises can really help you feel more in control whilst you're wearing a mask. And it's good to practice your breathing exercises with your mask off. So when you're relaxed at home, and then at home again, you can, here we go, I've got a mask here. So at home, practice some breathing exercises, and then you can pop your mask on. And again, relax. Try and do some breathing exercises with it on, and just get used to that sensation of having this on your face, but with relaxed breathing. And do take breaks as well. So you can find a place, if you're alone somewhere, if you're really getting sort of claustrophobic with the mask on, where you're alone, taking it off, just using the ear loops, take a break. Again, drop your shoulders, relax, do a few deep breaths, and then pop it back on as soon as you can. And just some tips for wearing your face mask is just making sure that you sanitize your hands. So hand washing, social distancing, all those things are equally as important as wearing our masks. Making sure that you hold your masks by the sides, and just that you've got a comfortable fit on your face. So it doesn't really matter whether you're wearing a surgical mask or a cloth mask, as long as it's comfortable, it covers your mouth and nose, and there's sort of no gaps. There's certainly, I think, no need for a lot of people just in the general public to be wearing some of these N95 masks. So these are the ones that we wear on the COVID ward at the hospital, and they're very uncomfortable. They can cause some skin breakdowns on your nose. So they're really not sort of for general use. So just make sure that it's comfortable. Practice at home, practice with it off, then put your mask on again, practice your breathing, and just feel more confident with it on. And so hopefully, taught you a bit about some of these basic breathing exercises, something that you can go home and practice. But if you do want more information, the Asthma Australia has some great resources online. If you wanted to find a respiratory physiotherapist, the Australian Physiotherapy Association has a database of respiratory physios. And if you're looking to join a pulmonary rehabilitation program, the Lung Foundation has a listing of all the programs in Australia. So I might hand it back to Karen and see if there's any questions that we've got.
Yeah, thank you so much, Janet. That was so informative, and it's so nice to have some really quite simple things that you can implement at home to make your breathing better. We do have some great questions that have come through, so I'll start going through them. One, and I think this was about the slow breathing, but I guess it applies to any. Does it matter if you breathe out with your mouth or your nose? Which would you recommend?
That's a good question. And it really depends on the person. So if you're very, very breathless and you have what we call that gas trapping, then actually it's very good to breathe out through your mouth. And so we often, to slow things down and to get the air out. So it's a bit like blowing out some candles. So where you're pursing your lips together and blowing out that way. So if you're very, very breathless and you're finding it hard to get the air out of your chest, then I would say breathe in through your nose and breathe out through your mouth, like your pursed lip and blowing out. But if you're just doing quiet breathing, then try and do it both through your nose, in and out.
In and out. Okay, great.
That makes sense. Yeah.
Yeah, I hope that answered your question. Next one, so can reflux symptoms contribute to less diaphragm breathing and more chest breathing? Years of previously have given this person problems with reflux, so stomach breathing can exacerbate it.
Yes, absolutely. So reflux can make you more breathless. It can certainly make you cough a lot more as well. It might contribute to more mucus in your chest as well. But your diaphragm is really important in getting that gastric sort of, the sphincter that goes through your stomach actually goes through your diaphragm. So every time your diaphragm contracts, it does tighten up the esophagus a little bit there and stops some of that reflux from coming up. So it's a catch-22 in that having reflux does affect your ability to do diaphragm breathing. But if you can do diaphragm breathing, it will actually help some of the symptoms of your reflux as well. But either way, it's good to see your doctor as well and make sure that you're on, some therapy for that, because it's more than just your diaphragm. You can often, like I said, it can irritate the airways, irritate your vocal cords, make you more breathless, and contribute to potentially more inflammation and mucus as well.
Yeah, absolutely. The next question. So this person's finding it hard to extend the out breath. They're not sure why. They've been an opera singer, so they've done a lot of breathing. I think I did see another one from the same person that pinching the nose helped though. So that's, is that something that you
So
see?
you can practice that. Practice that controlled breath hold. But if you're finding it really hard to get the long breath out, that's when it might be useful to try breathing out through your mouth. So breathing in through your nose and then so a gentle sort of blow, like you're gently blowing out some candles, and that might give you that extra oomph to get the longer expiration going.
Yeah, great. There's been a couple of questions about getting the slides. I'll just let everyone know now that we've actually developed a fantastic Breathe Better booklet that have all of these exercises in it step by step. So we'll be emailing that out in the next couple of days with the link to the webinar recording, so you can stay tuned for that. Another question here, is it normal to yawn while doing breathing exercises?
Yawning. Yeah, that's actually usually a sign. Yeah, yawning and sighing are actually a sign often that you're over breathing, so breathing potentially a little bit too much. And so the slow breathing and the breath holds should help with those symptoms, but it's usually because your body has this drive to breathe quicker. And so your body wants to breathe quicker. And so as soon as you slow down, it says, I need more, and you do a yawn or a big sigh or something like that. So gradually, as you practice that, it should get better. But at the moment, your body's sort of operating on that sort of need to breathe a lot faster than you probably need to. And that's why you're possibly doing those yawns and sighs. Because your body's going, I need more at the moment. So the more you practice it, it should get better, and you should be doing less of those things. But yes, it can be very common, especially when you first start out.
Yeah, I actually experienced that myself as well. And I've heard it said that a yawn is your body's reset, like reset your breathing. Is there any truth to that?
A little bit, yeah. So it's just that body's need going, I just want a bit more air. So yawning and sighing are often signs of that sort of subtle over breathing too much.
Yeah, great. We did have a question about Buteyko breathing. Is that recommended? It is somewhat similar to nose breathing.
Yeah, so all of these sort of breathing techniques, there's lots of different types. So you've got Buteyko, I think Papworth, yoga breathing. They're all very, very similar. So the premise behind them all is very much the same. So it's about slowing breathing down, using your nose and using your diaphragm. So a lot of them, the breathing techniques are very, very similar. Buteyko can get a bit extreme for some people. But the premise behind all of these techniques are very, very similar. And so that's why we've gone through sort of these 4 techniques today, because you see them in any sort of breathing program, and they're the ones that we know work.
Yeah, great. Another good question here, does vocal cord dysfunction contribute to disordered breathing, or is it the other way around?
That's an excellent question, and I'm not sure we know the answer to that. We know that they're definitely associated. So we know that people with vocal cord dysfunction often have breathing dysfunction and vice versa. And it could be that when you are breathing with your upper chest too much, you're using all these accessory muscles, which is putting too much strain around your vocal cords. But there's also other causes of vocal cord dysfunction as well. So there's lots of triggers for that. So we know that they're associated. We don't know which one causes which though, but they do often go hand in hand.
Yeah, so very important to do exercises like these if you think you've got either one of those.
Yeah.
Okay, another one. We've got lots of questions here, Janet. Can you explain why it seems harder to breathe when it's humid?
The humidity, yeah, that's a good question. So it depends, because some patients find it much easier to breathe. So I know that when you've got people who have a lot of excess mucus, they find the humidity quite useful, and that it can help clear their sinuses, clear their chest. But otherwise, it can often feel quite heavy, I think, is what the term that a lot of patients use. And so it does just add more hydration to the airways, is what the humidity does. And so if you've got sort of already hydrated airways, then having more hydration can just make it feel harder to breathe.
Okay. Okay. So this is not a silly question. There's no silly questions. What do you need to do differently to ensure that you're stomach breathing and not in the chest?
Yeah, very good question. And I think for a lot of patients, just getting, first of all, just relax, switch off everything that doesn't need to be on. So lie down. You can pop, a hand just below your collarbones, or even both hands if you want. And you could even just put a little weight on your stomach. So it could be a wheat bag that you've got lying around home, or a bag of rice or pasta. It doesn't have to be anything exciting. Put that on your stomach. And you want to feel that you are completely still in your chest, so there's no muscle movement there, and just breathing into your stomach. So you're lifting whatever weight you've got on your stomach, and then bringing it down again, and then up, and then down again. So that's a good way to check that this is not moving, because you'll feel it if it is. And then you'll have that sensation of that weight on your stomach to facilitate you using your stomach more to breathe with.
Okay, great. What is the best way to cope with a bad cough during an asthma attack?
Oh, yes, that's tricky
Probably
too.
try and take your reliever first of all.
Sorry?
Probably try and take your reliever first of all, but if you're
Yes,
coughing too much,
definitely.
yeah.
Yeah, so follow your asthma action plan. And then also some moisture as well. So often when you've got having an asthma attack, you have to breathe through your mouth. So this is when you're actually having an attack, it's not the time to go, I need to get my nose and this going right. Sometimes you just need to get air in, and often you're breathing through your mouth. So that's going to irritate, the dry air can irritate your airways and make you cough even more. But so having some sips of water, trying to breathe through your nose if you can, and relaxing your throat. So often it's these sort of triggers, and often it's that inflammation in the mucus as well, which can lead to some of that coughing. So we'll be talking, I think we're having another webinar about how to clear mucus later in the year. So that could be something we talk about as well.
Yes, absolutely. And there is a question there about huffing for mucus plugs, but we will come to that in our next webinar. We won't go into that because that's the whole thing in itself. Too much for question time, I'm sorry. There was quite a few more questions. This one person's very interested in the pulmonary rehabilitation program. She has trouble getting proper exercise. So yeah, definitely go on the Lung Foundation website. They have a list of all of them there.
Yep.
Would it be recommended to practice these daily to help reduce asthma symptoms, or is it that practice helps when you get symptoms?
No, absolutely. It's better to practice these things when you don't have symptoms. So breathing exercises are really good to do when you're well and you're stable. So every day, if you can, spend 10 minutes practicing your breathing exercises, because the more you do it, the more habitual it becomes, and it becomes sort of more unconscious. So you don't even think about it, and you're doing your breathing properly. And so what then happens is that translates into, when you're having an attack, that you're feeling a bit more on top of your breathing. So it's really important to practice these things when you're well.
Yeah, absolutely. And when you say nose breathing, are we taking deep breathing? When this person takes a deep breath, she starts to cough.
Yep. So I think it's important to slow the breathing down, and deep breathing doesn't necessarily mean big, quick breathing. So deep, I think we're talking about low down. So it doesn't have to be a big breath, but it's a low breath. And so often when you're breathing in too quickly and too fast, that can trigger that cough as well, so that rush of air. So slowing things down and just thinking about nose and stomach. It doesn't have to be big.
Yeah. Okay, there's another, actually we'll do this one first. How can you practice slow nose breathing with chronic, difficult to treat sinus problems? Is it okay to use your mouth slowly, and would you achieve similar benefits?
Yeah, so it's not as good to use mouth, but chronic sinus is you know, is horrendous. And so I really feel for people who have those things. So I think it's going through, and I'm sure you probably already have, trying things like, you know, your sinus rinsing, your sprays, seeing your ear, nose and throat specialist if you need to as well. But yes, even if you can just slow your breathing down and use your stomach, that will still be helpful. So, and then again, just treating the sinuses as best you can as well.
Yeah, yeah. And if I'm in hospital for asthma, being treated for asthma, should I use these breathing techniques?
Yeah, you can try. I think the slow breathing is really good. I think it can sometimes be really difficult to get that nose stomach breathing when you're actually having an asthma attack. But just trying, and that's where that breathing out through the pursed lips can be really useful if you're in hospital. But really just trying to think about that long breath out. So, because often you have that sensation like you can't get air in, but it's really often because you haven't been able to get the air out. So I often explain to patients it's kind of like a bag of apples. And if you keep putting in 4 apples but only take 2 out, at some point you cannot get any more in. And you've got that sensation like you just cannot get any more air in because you haven't gotten the air out. So really just thinking about breathing out if you're in hospital. Don't worry about nose, stomach, slow it, just nice slow pursed lip and get that air out. And that might help a little bit.
Yeah, I think that's really similar to this other question. So if someone's having an attack, it's that slow breath out is what they should focus on while also using
slow breath out, and that would be the one time too when I'd say blow out through your mouth, so your pursed lip breathing, because that gives you a little bit of back pressure into your lungs and helps you keep your airways open a little bit longer to get the air out of the air sacs.
Great. This one's an interesting one. It's okay if we can't answer it tonight, we can answer it offline. But does wearing a CPAP mask when sleeping at night change the way people breathe?
That is a good question, and probably one that I don't know the answer to. So I will find out.
Yeah,
I know certainly there hasn't been a lot of research around breathing patterns in CPAP, but I will look into that one. Yes.
Okay. Right. There's another question here. Just can you go over your recommendations about masks again? So I think it was that N95 masks are good, but they're not necessary for the general population if you're not in a hospital. Is that about?
Yeah. Right? Yeah. I think the N95s are really designed. I mean, that's what we wear on the COVID ward, and they're designed to. I mean, and they have to be fit tested to be really effective anyway. So if you're buying one that you haven't been fit tested for, then it's not necessarily as effective as it should be anyway. So once you have an N95 and it's been fit tested to your face, they're very, very restrictive and uncomfortable. You can get a lot of skin breakdown from it. And so they're designed for healthcare workers. And again, they have to be fit tested. And so they're not sort of generally recommended in the general population, but you know, your cloth mask is good as long as it's fitted and it's comfortable for you, or the surgical masks.
Yeah, so surgical masks or cloth masks, as long as they're fitted is the main.
Yeah, as long as it fits you comfortably. I know that some people find the surgical masks, it feels like you're breathing in bits of filtered something. Sometimes it can feel like you're breathing in bits of the mask. So a lot of people feel a lot more comfortable with a cloth mask. So it's whatever your sort of preference is, as long as it feels comfortable on your face and it gives you a good coverage of your nose and mouth.
Yeah, great. Okay, there's another question here about a technique that I wasn't familiar with. Just trying to find it again. It's been great tonight. Thank you everyone for your questions.
Yes.
So what is your thoughts on Wim Hof's breathing techniques? Are you familiar with that one, Janet? So
A little bit, yeah. So yeah, the purpose of a lot of his breathing techniques are sort of very different. So a lot of that's for sort of psychological wellness rather than sort of symptom control, which is what we're looking at when we think about breathing exercises for people with asthma. So Wim Hof is very much around psychological. So he does a lot of hyperventilation, so purposeful hyperventilation, and then followed by some slower breathing and things like that. So there has not been any studies in people with asthma. The research itself around that is not as strong. But again, my knowledge of it is that it's more around psychological, to manage psychological symptoms and to help those sorts of things.
Okay, sure. We're almost at time, so there's been one comment in the chat. This man wears a CPAP and his breathing is slower and he breathes in and out with his nose, so if that does help anyone else.
Yeah, and that makes sense because it would it would give you that support to help slow you down and breathe, so it probably would help your breathing pattern.
Yeah, I might just pick one last question and then we'll close and we can answer anything that we've missed offline.
Yep.
Is it good to use a fan on your face to help with breathing?
Yes, definitely. So there's lots of good evidence around using a handheld fan or just having some air flowing around your face. So it's really effective in breathlessness. So if you've done some exercise or you've done something that has made you very breathless, having that flow of air just around your nose and your jawline, it sends a message to your brain that you're getting enough air, things are okay. So it just helps dampen that sensation of breathlessness. So yeah, there's a lot of good evidence around using handheld fans to relieve breathlessness.
Oh, fantastic. All right, well, thank you so much. We're going to have to wrap it up for time, but thank you everyone so much for joining tonight. We do have a short survey, so you can see the short link on the screen there, or I've also linked it in the chat function. It would be really, really useful if you can let us know if you enjoyed tonight and whether you would find more information about breath retraining useful. We are planning 2 more webinars or classes around winter and around spring, around cold air and that kind of airway clearance techniques, and then around breathing with exercise as we get back into spring. So your responses to these surveys will really help us plan that future content. After the webinar, so the next day or so, you'll receive an email with a recording of the class and a link to our step-by-step Breathe Better booklet. So that has a guide to all of the exercises that we've gone through tonight. It also includes huffing and a little bit of tips around exercise as well. And we do have some nice short video clips of each of those exercises as well that you can access on our website. That'll be in the link in the email as well. So look out for those. If you prefer videos or prefer visual, we have options for both. But yeah, if you could please do the survey, that would be amazing. We hope to join us next time. Thanks, everyone.
Thanks, everyone. Bye.
Bye.